I'm so excited to be speaking to our guests today. They are aesthetic experts. We have Sue, nurse practitioner, and also Dr. Guns and Needles, based out of California. Please help me to introduce them right now.
All right. Hi, guys. Thanks for joining us. Hopefully, we'll give you some insightful things about the aesthetic industry, right? Out here in Southern California. This is Sue.
Hello, everyone. I'm Sue. I'm nurse practitioner. I work at the Skin Perfect with the Dr. Gideon Guns and Needle.
Amazing, amazing. So I'm going to dive right in. So tell us, how is the market? I would love to get a good perspective how the market is in California for aesthetics.
Ooh, the market is awesome.
It's really good.
I mean, I think people look at LA as being one of your meccas of, aesthetics for surgery. People in class, Beverly Hills, Newport Beach. I think they're part of the Real Housewives, so everyone looks at them to be the trends. So the aesthetic market is always strong here. Everybody is about LA, is about Hollywood looking good. You look good, you feel good, right? So the aesthetic market continues to grow. I do a lot of training throughout the country, and if you look at the statistics, California, Texas, and I think Florida are probably your biggest states with the most medical aesthetic spas as far as that's concerned. So, and the industry probably is only marketplaces, probably only about 9–10% of the whole US population that actually knows about it, that actually do it. So, our state's probably a little bit higher, but for the most part, there's a lot of room to grow. I think as people get more comfortable with these procedures and knowing that it can make you look natural. You don't have to look fake like those housewives.
No, I definitely agree. And I'm glad you put that 9 to 10% out there, because the industry is still growing so much that it's the beginning stages and has so much more to go.
It really does. I mean, I think you're seeing, because I actually do have a little school out here in Southern California from all the training that we do. One of my partners and I, just knowing how the industry is changing, you're seeing so many nurses, nurse practitioners, physician assistants, physicians not jump ship, but they're looking at this as an alternative to adding extra income to themselves, getting into industry that is much more rewarding, that is more fulfilling. Unfortunately, the medical industry is dictated by HMOs and PPOs and how you can do your thing. You've lost a lot of that self-drive. It's all related to what this is going to pay back, or what you can do, and how much time you can spend with your patient. This industry, where we get back to me, real medicine, which is not necessarily even just the treatments that we do, but we spend time chit-chatting with our patients and really getting to know them and their families. And so I think that's the big medicine that is lost, which is the artistry of it that we gain back in this industry. So we catch a lot of medical issues. I said to people like, no, you need to go check that out. Go see your doctor. As much as know what we can do, go see your doctor. So it's a fun feel.
Yeah, no, that's definitely interesting. Definitely interesting that you say that. Now, I know you specialize in PDO thread. You're like a master in that. Is that the newest thing out? Is that what you recommend to most of your clients? Tell us a little bit about that.
So I don't think PDO threads is it's new to the US. It has actually been in Asia for probably
2004 when I worked.
2004. So it's, I guess you say 18 years. So I've been doing this aesthetic industry since 2004. So 18 years here in the US. We only got approvals and clearances for usage of it within the last 5 years. But in Asia, Europe, Russia, they've been using it for probably 10 years plus, and lots of experience. And so you're going to get a lot of wild west. There's a lot, because there's so much out there already in the world. Some of the US companies that are bringing in threads are taking advantage because it's a wild, wild west. There's so many different types of threads, so many different players in the game from already being kind of robust in the outside world of the US, that the US is so narrow-minded, unfortunately, that I think threads is just, it's this new thing, it's this crazy thing. It looks like barbaric when you watch it on Instagram, but it does a great thing. And I will tell my patients, it's not going to take the place of plastic surgery. It is a bridge to that gap. It may be for those who are not looking for plastic surgery or don't ever want to address it, or maybe it's like 20, 30 years down the road, but they want something to kind of lift the face back up. It's not for everybody. There's definitely still patient choice selection on who's going to get a good result, who's not going to get a good result. But it honestly is truly amazing. You're going to hear a lot of pushback right now from plastic surgeons, unfortunately, because two things is, one, we're encroaching on their territory. They do plastic surgery, they want facelifts, and that's how they make their money. So I get it. The second thing is that we did have non-dissolvable ones. So they were ones that actually were permanent threads that were probably in the US probably about 8 to 10 years ago. And the plastic surgeons were doing it. And there was a lot of complications, a lot of adverse reactions to that. So a lot of times the plastic surgeons in their trainings are being told, threads are bad, threads are bad, threads are bad. So there's this back history with regards to where plastic surgeons have this thought that threads are bad. Fast forward now, the threads that we're using are dissolvable. They're not the non-dissolvable ones, so they're not permanent. They dissolve away within about 12 months and leave collagen where they are at. I think out there, plastic surgeons will put down, oh, it creates all this scar tissue and things like that. That's the biggest thing they say. And I'll tell them, well, it's a couple of threads. So you have a couple of strands of scar tissue, if you want to call it, it's collagen. But anything else that we do in the industry, whether it's Sculptra, if you've heard of Sculptra, or hyperdilated radius, these things are all about collagen stimulation. You can get more collagen stimulation from more scar tissue from those type of treatments than you would from one thread treatments. Secondarily, a plastic surgeon, if they are good, you do one facelift, you create total scar tissue in the face. So if I came back to you and said, hey, I'm ready for my second facelift, would they deny the patient of doing a second facelift? No, they're going to do the second facelift. Yeah. So that creates 100 times, 1,000 times more scar tissue than placement of a couple of threads in the face. So I would definitely challenge those plastic surgeons to actually try the threads, to actually make a decision after they've gone through some training with regards to it and get a decent outcome with it, and then truly evaluate where they can fit into practices. I think the plastic surgeons that I trained that are open to it are looking at it as something for those patients who are doing that revision. They've had 2 or 3 facelifts. Well, there's so much scar tissue. They don't want to go back and try to undermine that tissue because it actually is a lot more dangerous and a lot more issues with regards to doing multiple facelifts. People don't realize it. The more you go back in and do the same surgery, the more risk and things that you're going to have with regards to that. And so ultimately, this is a way for them to actually use threads to get away with not needing to maybe do that 4th or 5th facelift for that patient. And so I think I look at Korea as one of those places, and Sue knows more because she worked in Korea for so long with the plastic surgeons, but they use them in conjunction. They use facelifts and threads at the same time while they're doing it for certain cases. So I think the US is a little slow on that, and I think it's a territorial thing, unfortunately. When I first got started, my background in family medicine, it was more dermatologists and plastic surgeons that are the ones that need to be the ones that are doing this type of stuff. But if you actually look at it nowadays, it's more plastic surgeons don't have time to do this stuff. It's their nurses, their nurse practitioners, their physician assistants. They're actually doing all these treatments. Plastic surgeons in surgery all day long. So who do you want doing your face with these injectables and threads? It probably is the nurse practitioners And there are RNs and the PAs that are in their offices that are actually going to do a better job because they're doing it day in and day out. People don't realize that. They think, oh, the plastic surgeon's the guru. Well, they are the guru when it comes to their plastic surgery. And people don't take that into consideration. Same thing with dermatologists. They deal with skin diseases. They're not about doing fillers and Botox and all that stuff. That may be a secondary thing that they take on because their patients want it, but they delegate a lot of that to their extenders, their PAs, their RNs and stuff like that. So I think the industry has to have a different focus on who to evaluate as a good practitioner. You want to evaluate people who do this on a daily basis. They're going to be the experts. The people who randomly do it, they're probably not as good of an expert in doing it every day than the person who is really touching the patient and doing these treatments every day.
That's just totally true.
It's a weird thing because we in America, we like look for the experts, and plastic surgeons and dermatologists help themselves as experts. But honestly, when I go out and train, they're probably the worst ones. They probably really are the worst ones. I mean, there's some great derms and plastic that do good job because they actually take it into consideration to learn how to do it properly. But the rest of them probably, they're just doing it because their patients ask them and they're getting top dollar to do it, but they're actually probably the worst on the scale. I'd rather go to their nurse to get stuff done than to them themselves.
And that makes total sense because they specialize it, because they're doing it on a consistent basis. They're going to be better than a plastic surgeon, you know, so I can definitely understand that. I wanted to touch on Korea, Sue, especially you working there and getting that experience. Can you tell it, because like when I spoke to a provider in the Miami area, we're based out of Miami, she specializes in threads. She's been doing it over 10 years. And she said it actually originated there, and that's where most of it happened. Can you tell us a little bit about that market?
Oh, when I worked back to 2005, I worked at the, SM Clinic is top one in the South Korea for the derm. And when I work over there, my, dermatologist doctor started to bring, the thread from the Russia. They use the Russian thread. They originate from the Grecian thread. They start from there. So they practice each other, and they actually got the frozen their face and they cut inside and and they develop slowly use the different material, and they start to build up their own. Back in the day, they didn't have their own threads, so they got from the Russia and the other European country. After a few years later, 2006 and 2007, they start to recall the Rose thread, getting more like the Rose, the stems, Then they start to open up build up their factory, and they up the margin price went down, so started popular. So jump up, like every single, it has, do the thread, like the filler and Botox price went up at the same time, the price slowed down. So getting started to grow in the industry for the, top notch.
And that's interesting that it came, that Europe had an impact on that.
Yeah, Europe had an impact. I guess Europe did. The Russians actually.
Yeah, we used, my doctor used the, the Russian, thread at that time. We didn't have, Korean, thread back 2004. And they started, brought the, that, procedure and started to use, and they created their own thread because Asian has a different skin, and they need a different material because of the inside of, the skin has a different, strengths and the different, the anatomy. So they started, making their own. Same thing as Botox and filler, because the Korea didn't have the Botox and filler. We imported from Europe or America. After that, they created their own Botox and the filler, more designed for the Asian too. So it's the same concept as thread.
Wow, that's very interesting. Very, very interesting. Now, Dr. Guns and Needle, I know you teach people all over the US, right? And you teach them on PDO thread. Can you tell us how long it takes really for a provider to learn that practice, and a little bit about what they learn at your program?
I mean, ultimately, threads is something that I would probably say if you're getting into the industry of aesthetics, learn your toxins, learn your fillers, learn your different tissues on how to inject that first. When you're comfortable with your fillers, then start to consider adding threads in there, because threads can be simple if you know what tissue plane you're placing it in, and you get a feel for it. Just, you know, every day you start to do things, you just start to get a feel for things. When you're good with your fillers, you start to understand what tissue layers you're at. If you have that sensation, I call it the sixth sense, doing threads becomes a lot easier. Then it's about figuring out how to design your thread, vectoring, how do you want to lift the face, and you're not focused as much as how to do the treatment. It's more about playing around with the artistry of it, and that takes you up very, very quickly. You know, our training, we have a training school out of here in Southern California, out of Brea, and then I'll train for the different companies around the country if they ask me to go out there. So there's a lot of different avenues that people can choose. They can choose to come to our school. We do trainings for them, but they can also reach out to the companies. A lot of the companies out there, like Mint PDO, Miracu, I know Nova Threads, all of those do have their own training programs that you can reach out and they'll hire one of us to come out and train, or you can fly out to us and train if you're not looking at a different school. But there are different programs out there besides the company. So a lot of different trainings. I think you just have to, when it comes to trainings, you need to make sure that the training really is helping you understand the why. I think in the industry, when I am training on a lot of the Botoxes and the fillers, I think when you go out there and I'm training and asking these nurses and doctors, like, hey, do you understand this? A lot of them haven't actually been trained well. They actually don't know the why of what they're doing. They don't know the anatomy of the area. They've just been taught point and shoot, point and shoot, point and shoot. And they're just said, put this amount there, put this amount there. And they really don't understand why they're putting it there. They just know that you stick it there, Botox sticks there into the muscle and it freezes the muscle. But they don't really know how to adjust it. But patients' muscles are different or the anatomy is different. How do you adjust for that? So they don't understand why they're doing something. They're essentially, you know, the proverbial verbiage is they're taught to just they're given the fish instead of taught how to fish. Is really what we're seeing, unfortunately, a lot in the industry is people will take smaller class or quick classes. You pay $500, you take this class and they're cattle herded together. They're on stage, they show you, okay, inject here, 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 these are the muscles, and go. You get your certificate and you go. And that's the hard part in the industry currently. And why I still say it's wild, wild west, is because even though the industry has been around for 20 years, there is no standard across the board. There's no board requirements. You literally just take a course and you get a certificate of completion. It doesn't mean that you really understand it. It just means you completed the course. And people don't realize that people out there really don't understand sometimes what they're doing. And they're just pointing and shooting and just shooting things in there. And yeah, I mean, you as a layperson could probably do it. I mean, that's one of the trends on YouTube is the do-it-yourselfers who will buy products online and just inject themselves because they watch somebody on Instagram do it. Dangerous. Probably half the time you'll be fine, and then other half the time you'll run into big issues. And you know, people don't know the ramifications. You inject a filler in the wrong place into a blood vessel, you get a vascular occlusion, your skin could die off. You inject into areas that are close to vasculature that goes to the back of the eye, you can actually go blind. You know, these things can't kill you, but it can have some serious ramifications that people don't understand. These are things that can happen, why it does take trainings. And you know, it's not, and hopefully practitioners out there understand it's not one training, it's 2, 3, 4 trainings just to keep learning and keep advancing. And then even when you're comfortable,
Still, you know,
still you're not comfortable and you're still learning and still training. And that's the fun part about the industry, and it's also the dangerous part of the industry because it is constantly changing. And people have to understand why they're doing things. And I think a lot of the practitioners out there, probably a good 50% of practitioners don't know why they're doing something. They just stick a course and like, I'm injecting Botox in this area, right?
Yeah. I highly recommend, you know, practitioner or injector take the diastatic, you know, class, Galderma training. They actually have to open up the, you know, inside of skin, you know, the smart.
Cadaver classes.
Galderma class is the best. So you're not gonna make a, you know, less chance to get the mistake. even though I've been doing, I don't know, I'm pretty much call myself beginner, but I feel like never enough, even though I get a training, 3 times a month, 4 times, I feel like I'm never enough. So I don't feel like, comfortable. That's why I need to keep, keeping up with the new skill, because even though while we are sleeping, the new technology is coming up every, single day. So you have to keep up with it. You have to be passionate about this industry. You have to study hard. You have to study every day. It's not ever enough,
Yeah, I think you just have to be open-minded to receive that what you've been doing could actually be changed. And I think I learned this even in regular medicine. I mean, from the time when I was in medical school to the time I went to residency, blood pressure and diabetes management flip-flopped. And then by the time I graduated residency, it flipped off again. And so I haven't done family medicine in 18 years since I left residency. But even though you stand on the sidelines and you watch it, it just keeps flip-flopping. And people have to realize, as much as medicine is a science, it's also an artistry. And I think the artistry is lost. And so in this industry, even more so, it's medicine and artistry, and you have to combine it. And people have to realize there's no one right way to do something. There are foundational knowledge things that you have to understand. And then the rest of it is critical thinking. Like, can that do that? What's going to happen if I do that? And then trial and error, finding your good patients, finding your staff and playing on them and seeing, okay, that actually did work. I like that. That's how you kind of advance, but it has to do with a lot of critical thinking, understanding, like Sue was saying, cadaver courses to see what's underneath the tissue, where blood vessels are, where muscles are, how they all interplay, and then taking that and to say, okay, this is what this product does, this is what I can do, this is what it can potentially do, and putting it all together. It's a mixture of a lot of jumbled pieces that you put together as a puzzle, and that's what creates your medicine and artistry. And I think that's the fun part in the field for people who really want to keep pushing and advancing themselves.
And I think I always tell the practitioner, even though I see injector or experienced injector, I always ask, how can you handle the emergency situation? How can you handle the occlusion? How can you handle the ptosis? You have to, handle, the emergency or accident, any aftercare, the side effect. That's the most number one important. That's the best injector you can be. You have to handle every single, the emergency and handle the situation. That's the priority. I always educate my practitioner. I speak to the doctors, discuss about what's the best way. Because before you even inject, you have to handle those kind of issue were happening. I think that's the best injector before even you do great job no matter what.
Wow, yes, and I totally agree. Like, training education is where you get most of your effort. It's where you become the best. It separates you from just being average to extraordinary, so I definitely can agree. I wanted to touch on one of the points that you made, though. I know I just went to a conference and they told me that, especially when injecting, different cultures, different races, like everybody needs different levels because of their proportions and things of that nature. And especially being in LA, I'm sure you see every different type of person. How do you kind of juggle that? How do you manage that and assess that?
Yeah, I think anatomy is anatomy. There's a foundation that everybody kind of ages the same. We have a bone level, we have a fat level, muscle, fat, skin. If you kind of break it down anatomically, we're all humans. We're gonna, for the most part, age the same. Genetics, ethnicities potentially can change areas that you're going to age a little bit faster in those areas. Some person may lose a little bit more in their temple. Some people lose more in their under eyes. And that's genetically kind of how you're predispositioned based off of your genetics, your environment, things like that. I think anatomy, that's why we go back to cadavers, is going to be the same kind of potential aging process in the sense. From there, you kind of take the ethnicity groups. I was lucky enough, I got started when I opened my first clinic, it was all Asian. So I learned the Asian aesthetic a little bit more so quickly. And then I started to see more Caucasian, Hispanic, African American, and then that's where you start to develop an aesthetic for each ethnicity group. And you fall in line with that artistry. And this is why I say the importance in this field is really the artistry of it. I think people focus too much on injecting where, injecting this way, injecting that way, and they lose sight of actually the art. It's kind of like when you're painting. Okay, do I do this brush stroke? Do I do this brush stroke? Do I use this color? They're so focused on that they lose sight of what they're painting in a sense. And I think that's what happens in this industry. And then in the beginning, of course, as rightful it is, you're starting off, you're going to reciprocate, you're going to copy things. Okay, I'm going to put point one here, point one here. But then your goal is to sit back and say, okay, was that enough there? Did it make enough of a change? Is it what you're looking for? I know my Asians, we like to add a little bit more volume in here. Caucasians and Hispanics love that higher cheekbone in that sense. African Americans, actually, we do a lot of noses because there's a little bit more of a flatter bridge. And so there's a lot of things I think that as you get into the industry, you have to take into account for the art. And really, I think people spend too little time on the artistry. I mean, one of the things when I teach practitioner, I say is sit in a busy mall or cafe or something like that, put on a pair of dark sunglasses and stare at people. I mean, you literally have to stare at people. What is it that makes that person attractive to you? What are the features? How are the cheeks up in line? Where's the brow positioning? How do their lips look? Is there a balance to the lips, the chin? There's so many different features, and I think you need to stare at people, even between a male and a female. If you inject a male incorrectly, you can feminize them. If you inject a female incorrectly, you can masculinize them. And not to say that there's not anything wrong with that if there's looking for that. There's fluidity with gender nowadays, but ultimately you need to understand what your patient's expectations are. What are they looking for? And that's the art of all of this, is figuring that out and then being able to put it on their canvas, which is their face. And so I think that people don't take into consideration this ethnic aspects of it, and then the expectational aspects of what it is. But at the end of the day, to me, it really is the artistry of it. Learn the basic foundations, and then from there, take it to the next level, which is the artistry of it.
Nice, nice. Now, I specialize in really placing providers inside of the aesthetic and dermatology industry, like PAs and NPs. What are some, and I know you do a lot of hiring, Sue obviously works with you. What are some things that you look for in a great provider, or that makes a great provider?
Honestly, like someone like Sue. No. I mean, honestly, it really is like even though she's been doing this for 18 years, she is constantly striving to keep learning and to be humble in the field, I guess, is to not be, oh, I know this, because I've gone to a lot of trainings where people have been injecting 10 years and they're like, oh, well, I've taken a class from this person and that person. And they act like the know-it-all just because they took one class from, one of us that's been on the stage. Okay, but does that mean that you know what you're doing and you're taking your artistry to that level? Because when I watch those people, they're probably not very good at what they do. They hide their accolades based off of who they've gone to a conference, who they've taken a picture with, blah, blah, blah. They per se themselves haven't done enough to qualify, in my book, as somebody who's actually a good injector. But I think a person who is really, really taking it to the next level is always getting themselves educated. And that's the first thing that I look at when I look at a practitioner is, are they open to changing? Are they open to challenging themselves? The way you do things that I've done it, I constantly am changing my technique based off of different thought patterns, based off of, I took a cadaver class. Oh, that's great. Or I listened to a conference and I heard somebody say something that sparked something in my mind. I'm going to try that out. I'm going to play around with that. And it could take you and open new doors. And I think that that's going to make a practitioner from a good practitioner to a great practitioner, is somebody who really is open, who will take their artistry to that next level, be open about it, and constantly educate themselves. I think that's the biggest thing in this industry, is just because you took one class, that doesn't mean crap, really, honestly. I mean, I get nurses and PAs and doctors all the time asking me, oh, how do I get in the industry? How do I get in the industry? I said, well, you're coming into the industry for one thing at a time when there actually are a lot of people trying to get in the industry. So what's going to separate you out is, are you paying for your own education? Because at the end of the day, your medical education has nothing to do with the aesthetic industry. Yeah, you have a little up on that layperson who isn't in the medical industry, but at the end of the day, it's getting in the aesthetic industry is completely different than starting an IV, completely different than seeing a patient in your clinic. You have to have a different skill set. And so the nurses and PAs that are coming in from ER or trauma and stuff like that, like if you want to get into this, take some courses on your own, pay for your education, you know, and at the end of the day, I'd even tell them, reach out to clinics and see if you can even work as, don't get paid. Look as an internship. Like when I went to medical school, the next 3 years of my education was actually intern. Yeah, I got paid, but literally I was working for like probably $2 an hour. But that's how you got your experience. That's where you really gained that knowledge, because you're putting yourself in the position to gain that knowledge. And if you're not putting yourself in there and you're like, well, I just want to get paid $70 an hour and you should train me as well. I don't know any industry that really does that. I mean, when you go to nursing, when you go to PA school, you spend gazillions of dollars to get to that level, that now somebody who comes out there can tailor it a little bit to the way they do things at their hospital system or at their clinic. But you have a base skill foundational set for them to work off of. When you come to an aesthetic clinic and you don't know how to hold the needle because you're holding it like this, I can't work with that. You know, you need to go get educated. And I tell this time and time again, because I meet a lot of people who reach out on Instagram, like, how do I get in the industry? And I say, go take a class, you know, start off, if you can't afford it, take a cheaper class where they are hurting it, knowing that, okay, I've got a little base of foundation. Now I want to go research more. I want to go learn more, because this is an industry that honestly is on its own. Even dermatologists, even plastic surgeons in their own residencies currently nowadays, they're getting a tiny amount of an injectable training, a tiny amount of a little laser training, but they really are not focused on it because plastic surgery is about plastic surgery. Dermatology is the study of skin diseases. They don't even learn that much unless they actually have a program that actually started to bring in a little bit of aesthetics. Now they're starting to get a little bit. But honestly, when I started in the industry, none of them actually were trained in it. We all had to go out and learn on our own. We had to go pay for our own education. We had to go grab education. So advice for all of the people that you have out there is, don't sit on your high laurels that just because you have a degree that someone's going to hire you in the industry. I mean, there are a lot of people that are getting in the industry, and to get advantages is to go out there and get educated yourself on being someone who is teachable, who already has a foundation, knows what Botox is, knows what filler is. You may not have all the experience, but at least you've taken courses that show me you're actually interested in. You're not sitting here waiting to be like the middle generation that we complain about, that just sits around and waits to get handheld fed to get dragged along in life. This is an industry, if you really want to excel, you have to push yourself to excel.
And I also recommend the new injector who want to jump in the aesthetic industry. And a lot of new injectors say, oh, I don't want to do laser. I want to do just injection and Botox and filler. But I highly recommend to just cut it down, that attitude. You guys start to have to handle the skin and different ethnicity and the background. You have to play with the skin first so you can see the different anatomy and balance. So I highly recommend to start, new injector, start medical pill and laser procedure. You have to play the face and body enough time to play with the laser. When you reach up the next level in the injector, you can play everything. You can't be just, oh, I'm just injector, I don't do laser. That's kind of not right.
There are that. I mean, yeah, I completely agree, because when I first got started, we only had one Botox and one filler, and then the rest was all lasers and stuff like that. And so I learned to do a lot of skin things, learning about skin, learning how it reacts, learning all of that. And that's where a lot of critical thinking comes from. Fillers and injectables, there's a lot of critical thinking that go along with that. But I think that people who lack that skill set to really start to get critical thinking, I think it really shows nowadays, because people are starting to buy all these lasers and all these like treatments like Morpheus is a super popular one right now that you hear. Well, they tout, oh, I can go really deep. I can go really deep. Well, people don't realize you go really deep, you're going to kill fat. Yeah, you make a little bit of skin tightening, but guess what? You're going to kill that person's fat, and their face is going to droop, and the skin will be tighter, so they're still going to look droopy. And this is my biggest fear in the industry is people are doing things because it's a trendy thing, especially practitioners are buying trendy things without actually doing their own research and learning beyond what a training session from these companies are. Remember, the laser companies are all going to train you just to use a machine, how to turn it on, how to use it. They're not training you on how to get effective results. You need to go and get educated on how to get effective results. You need to go in, learn about the skin. How is it, what is this treatment doing? What is it doing to the collagen? What layer is it affecting? And how the skin reacts and everything like that. I think people don't pay enough attention, and I agree with Sue. A lot of my clinics, we do the whole gambit of things, because when you are aesthetic clinic, you shouldn't just be doing a filler and Botox and maybe some threads. I mean, you should start doing some skin issue things to tighten the skin, because all layers of the face are aging. And if you miss that top layer, which is, I call it the Spanx of the face, you miss the whole boat, because if the Spanx ain't tight, everything could be really great underneath and it still doesn't look all that great. It still looks okay. And so ultimately, I think that's where a lot of the practitioners really need to really get critical thinking and realize that a lot of people don't pay enough attention to that aspect of it. And so lasers, I agree with Sue. It really is important to be all around and not be, oh, I only do injectables. That's all I do. Well, you're missing the boat if you're really talking about taking care of your patient and really walking through this true anti-aging process.
Wow, yes, and those are so many good points that you guys just made, because a lot of providers don't know this stuff. They just hop on the next trend. It's like, oh, this works, but you're actually, talking about it from a really good point. Like, you got to do the research yourself to really have that longevity, and that's truly amazing. I love it. Is there any conferences that you would recommend? I know you guys talked a lot about training and things like that. Is there any conferences that you can recommend?
Ooh.
Aesthetic emergent class is really amazing. With Mari and Dr. Gideon.
Our school is called the Aesthetic Emergent, so we do have a digital platform and stuff like that. Conferences, I think LAMC was a good one. That one was a good one. I think a fun one, if you want a mix of good, I think that I hear a lot of good new technology tries to come out into there. But there's a little bit of fun, good education. I think the aesthetic show in July is a really good one. What else?
I personally take the CME class. It's free, so you can do 4 times a year. So you can apply for the hands-on trainings too. So I always attend 4 times a year. So also take my friend and get the free training, and you can get a free CME credits.
They have like Paradigm, Ex Medica. They're online. Sometimes before COVID, they would actually do some in-person type of things at the different things.
Yeah.
They're sponsored by grants from the company and stuff like that.
I like the Paradigm.
Conferences, other than that, AmSpa is a decent one. I think AmSpa, if you want to focus on a little bit more business, they have a little bit more business oriented, because they're based off of the lawyers that started that conference. And then Aesthetic Next is not bad. That's hosted by the people who do the EMR aesthetic record. That one's in Dallas, I think in September. Other ones, unfortunately, it's the Informa group that bought them, like Vegas Cosmetic, the Aesthetic Show, Miami Cosmetic. They're all kind of about the same. I think when you first start, choose one conference, rotate and go to the different ones. And then after that, honestly, I feel as though you should go outside the country. IMCAS in January, February in Paris is a great one to go to get some international stuff. AMWC in Monaco, which is I think happening this week or next. is a decent one to go to. Those are the two kind of big ones that people talk about. I think there's one called Face in London. I think some of the international conferences are great because they have international speakers. Here in the US, unfortunately, like I'll get asked to speak at this conference, that's conference. You kind of get the same people speaking at the conferences, because people don't realize this, but majority of those conferences, they don't pay us to speak. They may pay for our flight, they may pay for our hotel room, but they don't pay for us to be out of our clinics to speak. Now, the sponsored ones, the sponsored talks that are at these conferences that are maybe put on by Mint or Galderma, blah, 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 they will pay their speakers to fly in and speak on the conferences. Those are typically sponsored and not going to be part of the CME credits that you get, because unfortunately in the US, CME credits means that it's non-biased, which means nobody can pay you to speak in a sense. So we're kind of in catch-22 because it has to be people who are passionate about speaking, who are okay with, unfortunately, losing money from leaving their clinics and flying out and speaking at a conference and being there for 3-4 days. I mean, that's a pretty significant amount of income that they're losing from not being able to see patients. So I think you have to be understanding that these conferences, when you really learn about conferences, and I'm on the back end now, I'm like, oh, okay, that's why you see a lot of the same people, is because they already have, a PowerPoint ready, and they want to be a little bit more on stage, and they're okay with spending some time being on the conference circuit and stuff like that. They're probably more KOLs where they get paid on the back end to do other speaking engagements that they're okay with, blah, blah, blah. But people have to realize there's a balance in the industry when you go to these conferences, that a lot of these speakers who are speaking don't get paid to do it. They may get their flight paid and their hotel room cover, but they're not paid for their time to speak up there. And it does take time to create these PowerPoints. Like, now that I'm on the other end and creating PowerPoints to speak, I'm like, good Lord, this takes me like a day, 2 days to put a good PowerPoint together. And then to not get paid for it, you have to realize out there what you're getting when you go to these conferences, that people are passionate. You have to definitely thank them for spending the time to go to these conferences and speak. But granted, unfortunately, when you start going around to the conferences in the US, you kind of see the same speakers at all the same conferences. And that's the reason why, is that it's hard to go out and speak, because it takes a lot of effort and it takes a lot out of your own personal time to go to these conferences and speak. So, mix it up, go internationally, go to some of the US conferences, mix it up on a yearly basis, spend a little budget and travel and stuff like that.
And I'm glad you mentioned international training, because I think it's definitely worth it. I think that's where you get most of the different knowledge. Like you said, threads weren't even in the US. So getting that information is unbelievable. For sure.
Yeah, and the thing is, you guys have to realize that it's different regulations. Our US regulations are very harsh. Our FDA is harsh. I mean, when we get a filler approved, it's for one specific area, a cheek, and it's labeled for a chin, versus when they get it done in Canada or in Europe, it's full face indication. So they can teach all over. And so, that's the hard part, is that here in the US, we're restricted. Like, if you rely on companies to train you, you honestly don't get the best training, because even though, you're getting a great speaker to come or a great trainer to come out and train you, I can only speak and train you on the FDA approved areas. So I think a lot of people who think, oh, I'm getting trained by the companies, you have to realize that we're given the golden handcuff. Yeah, we're able to talk about the product, but we can only talk with the product with respect to the area that FDA approved. Many other areas like temples, under eyes, other areas, and using other products like Kiss, instead of just using lips, I love the under eyes. And so it's really hard pressed for me to really tell you what I really do in my real practice. I have to base it off of what the FDA restriction and guidelines are, because I'm now an extension of the company. So if people say, oh, I'm getting trained, well, are you really getting training on your own and paying for it for people who are actually able to talk, you can say off-label and without recourse from the FDA? Those are what I consider training. Trainings from the companies themselves are great. They will elevate you in perfecting those areas nicely, but we're restricted when we talk. We can't talk per se off label, and that's the hard part. So understand that as kind of the difference out there.
Amazing, amazing. Well, thank you so much both for you joining me and speaking more about the aesthetic industry, and honestly, so much education on what new providers and new experienced providers should be following. Can you tell everybody where they can find you and anything you have next?
Sue?
Yeah, let's grow together.
How can they follow you?
Oh, I don't. I'm
She's on
horrible Instagrammer,
Instagram.
so I don't have many posts. Posting pictures. I'm
Come
so
on.
busy, so, and I'm not good at the.
DM
nice
her,
things.
follow her, ask her questions.
Yeah.
What's your Instagram?
NP2 inject. So
NP2
please
inject.
follow me. If you have any question, I will try to give you best answer. Okay. I hope to see you guys in the West Hollywood Steam Perfect.
Yes, she works here in West Hollywood. So if you're out in West Hollywood, look for Sue. Mine's is was it Dr. Guns and Needles? If you know. So you can follow us there. You can follow us at Skin Perfect Medical. That's the name of our company. We have about 7 locations here in the Southern California area. Our school that we have with my partner Lori Robertson is called the Aesthetic Immersion. So at the Aesthetic Immersion, and that's out of our Brea location. I think the next couple of conferences that I'm going to be doing, I'm going to be at probably the Aesthetic Show this year, speaking. We're doing a Mint PDO conference. So people who are trying to get into threads, it's a virtual conference. It's right now, if you sign up before April 1st at Mint PDO, you will get it for $49, and you'll get all the previous webinars. You'll get the full day of us doing. We have like 6 or 7 KOLs from around the country, and we're live virtually doing patients on that day and teaching our techniques, and we get to do advanced techniques and stuff like that. So that's a great conference, a virtual conference. I think it's April 23rd. It's on a Saturday, so it's a full day thing. If you guys join, $49. Come on, guys. If you want to learn a little bit about that, that's a great little conference. I am doing one in September for CAMA, which is the Canadian Medical Association up in Canada. I think Sheena's going to be there, Julie's going to be there for the fauna. So a lot of good speakers will be up there doing master classes. So that's in Canada in September. You can look up at CAMA, C-A-M-A. That will be something that we've done in Toronto. And maybe at Aesthetic Next this year. So a lot of little conferences.
That's amazing. That's amazing.
So yeah, so you guys have questions, and reach out to any one of us. More than welcome to ask questions and hopefully help guide you along the pathway, because the aesthetic industry is big and it's still keep growing, and stop competing against yourself and work together to elevate. The more we elevate it, the more comfortable our patients are going to be to get this stuff done, instead of being afraid that they're going to look fake and unnatural and stuff like that.
Yes, definitely. I can understand that. Well, thank you so much. And until next time, bye.
Peace out, guys. Bye.